is Wendy Jones, and you're listening to The Patriot FM 101.5 AM 1400. Welcome back to Next Steps for Seniors. We're here today with Rakel from New Life Medical, and it's just a fascinating, I would say, really fix to knee pain. Like, anyone who needs to have surgery or has severe pain, why would you not entertain New Life Medical? I think it's a phenomenal program that you guys are offering. I wanted to ask a few more questions, and then we're going to go into what the consultation looks like so that our listeners would be able to understand what happens in your office. But you talked about needing physical therapy after this process. Tell us a little bit why that would be necessary.
So we typically like to offer physical therapy during the injections, actually.
Oh, okay.
So we have patients go to physical therapy either prior to coming to see us or the following day or 2 days after. It usually is the best treatment protocol, and the reason why is because we want to strengthen the joint along with the injections. A lot of my patients will say it's very hard for me right now to go to therapy, so can I go after? Yes, most definitely. As long as you're still going to therapy, I'm okay with it. But I really like to have my patients go during, because the whole protocol itself gives the patients the best outcome. So going to therapy, they do modalities with the knee, so they do stretching, they do exercises, they do strengthening, and I've been recommending a lot of water aerobics. I know we talked about it.
Mm-hmm.
I love water aerobics. It's fun. You get to know people there, and you get to make friends, and you work one-on-one with the physical therapist, and you're in the water and you meet the resistance from the water, so you don't get that extra pain from working on the floor or on the ground. That's really hard on the joints. So that's why I've been recommending it so much, and my patients all come back to me and they tell me how much they love water aerobics. They say they meet all these new people and they feel so much pain relief from their sore knees after going to water aerobics, and I'm like, oh, I just love it. I'm going to keep prescribing it. So insurance will cover it as well. Your visits for water aerobics will get covered. So it's one of my top prescribers right now is definitely going with water aerobics.
So let me ask you this question, and that's great that all these people now are having so much fun
Yeah,
in water
right?
aerobics. And they've got volleyball water
Yes,
and all
right?
this other stuff you can do in the water. But let me ask you this. So when someone calls your office, let's talk through that whole consultation process. So give your phone number again, because they're going to call your office.
Yes, of course. Our phone number is 248-952-9190.
Okay, and they're going to get the front desk, I'm
Yes.
assuming, and then talk us through this process.
So you will call the front office, and you will talk to one of our medical receptionists or medical coordinator, and they'll take your name, your phone number, and then your date of birth and your address. And from there, they'll schedule a consultation, which you can most likely get in within the week.
Okay.
Which is great, either within the week or the following week. And then what you'll do is you'll come in and we'll ask you to bring your insurance cards just to make sure that you're covered. And we'll take copies of that. And then you'll come on in with one of the providers. And we have 3 within our clinic. We have 2 nurse practitioners and then a medical physician. And you'll speak with us, and we'll go over your past medical history, past surgical history, your allergies, your medications, your knee pain and what exactly is going on, how long it's lasted, what other treatments you've done, what other injections you've received, what other physicians you've gone to, orthopedic surgeons if you have. It's a very, very detailed consultation. And at the end of your consultation, we will take x-rays of the knees, and we will go over it and specifically what is going on with the knee, and we grade your knees based on the severity of the osteoarthritis. And we use a Kellergan scale, which is used by all providers. It's a criteria assessment for osteoarthritis, and we grade the knees on a scale of 1 to 4, 1 being doubtful, 4 being severe, 2 being moderate, and 3 being moderate.
And you can do any level. You can help.
Yes.
You can help people who are severe at stage 4.
Yes.
What if they have had knee surgery in the past?
Unfortunately, these injections, that is a contraindication. If you've had a total knee replacement, you cannot get injections. You have an artificial knee, so those injections will not work on that. Partial, they will. You still have part of your knee in there. So.
Okay, so partial you can definitely do
partial
it.
you can.
Okay, and good to know. And sometimes people have, like, partial on one knee and they
Yep.
don't do the other.
Exactly.
So you could do both of those.
And I've had many, many patients that have come and seen me like that. They've said they've got a partial knee replacement or they've gotten a total knee replacement, say on their right knee, and then they say it wasn't successful and I don't want to go through the whole surgery again. I don't want to go through the 3 months of rehab again. I want to do something different for my left knee. Let's try these injections. It's an alternative. Let's try it. If it works, great. I'll continue to do that.
Why not?
And I've had so many patients that have come and see me and it works. And they say, I'll continue to do this. It's way better than, they leave my, after we give injections, they leave and go about their normal days. There's no downtime. Absolutely no downtime. So it's a very easy process. So
Right.
that's why patients continue to come back and get these injections.
Okay, so through the process, they went through the front desk,
Yep.
they went to their first appointment, which
Yes.
is within the week,
Yep.
and then who do they meet with, you?
I'm one of the providers in the office, yes.
So tell us what exactly you do.
So I'm a board certified family nurse practitioner. Just a little bit about myself. I graduated from the University of Michigan. Go Blue.
Go Blue. Of course.
So I actually worked in surgery for about 6 years. So I got to see a lot in surgery. I worked with a lot of orthopedists, and I saw a lot of successful surgeries, but I also saw a lot of unsuccessful surgeries. So I had to follow up with patients after surgery, and a lot of patients did not get the pain relief that they wanted. And I really wanted to connect with my patients, so I decided to go outpatient and consider alternative therapy and regenerative medicine. And that's why I work for New Life Medical. I loved what they had to offer, and I love that they're giving patients another chance, other than just going with just surgery. I loved my job in surgery, don't get me wrong, but
And there are times that we have to have surgery.
Exactly, where surgery is necessary. However, I saw a lot of cases where patients didn't try any other types of therapies prior to going to surgery, and it broke my heart because they didn't get the relief they wanted, or even worse, after surgery. So I really wanted to be that advocate for my patients, where I would offer them something prior to them, choosing the last resort, which should always be surgery. And I've noticed that over the past couple of years, I've changed so many lives, and by just giving giving injections, but really it's a big deal, yeah. And my patients it's such a rewarding job because my patients get this pain relief and they're able to go about their activities that they weren't able to do before. Hanging out with their grandchildren, going shopping, going to the grocery store without using what do they call those? The hover rounds, going around and just the little activities, playing golf, with their friends, and they come back and they see me after 6 months or a year and they're like, you changed me, like I'm able to do all of the activities I couldn't do before, and it's just so rewarding, and I'm so thankful for it.
So as of right now, it's covered every 6 months. You said someone can
every
come
6
in.
months, yes.
So forever? I mean,
Yeah.
or is there a limit of 5?
No,
Okay.
Insurance will continue to cover it every 6 months.
Well, we're gonna pray that continues too.
Yes, most definitely. However, patients don't necessarily need it every 6 months.
Oh yeah, they can go up to 2 years.
Yeah,
probably.
exactly.
Yeah, it's definitely worth it. There's no doubt in my mind. And you know what you were talking about? I just give injections. You know what else you do? You encourage them to do water aerobics.
Yes, I do.
Little did they know. Oh my gosh, I'm going to have so much fun. Good thing Rakel told me to do water aerobics.
Yes.
And physical therapy lasts for about how long?
So typically physical therapy we prescribe for about 4 to 6 weeks. We have the therapist decide under their discretion what they think is necessary for the treatment weeks. So I always give 4 to 6 weeks. Usually my therapist will say about 5 weeks. Yeah.
Okay.
Mm-hmm.
Yeah,
5
and that's
weeks of
like
therapy.
only once a week, right? Or a
Once or
couple
twice
times?
a week. Yeah.
Okay.
Mm-hmm.
Okay.
Once or twice a
So
week.
if someone that's listening to this program right now is like, okay, so I basically have to cross off 5 or 6 weeks.
Yep.
And I go from major pain in my knees to feeling pretty darn good and able to do some things that I wouldn't be able to do, like mow the entire lawn.
Exactly.
Why wouldn't they take it? And it's just a couple days a week. It's
Yep.
not even like you crossing off the entire week.
Yep, 1 to 2 days a week. That's all it is. And you leave my clinic and you go ahead and you go about your normal day. It's not there's no downtime. You can go back to work if you needed to, or you can go hang out with the grandkids after if you wanted to, or you can go golfing after.
Right, you don't need to go home and spend the day in pain or anything.
Absolutely not. No.
So, do you find that most people are elderly, or do all ages? Like, what's your average age, do you think?
Average age, I would say, is about 65 to 70 is our average age.
So that's young.
Yes, most definitely.
It's so funny, as we get older, we're like, oh yeah, that's young.
Yes,
Yeah.
but we do have, I've taken care of patients who are young as well, in their 30s or 40s, 50s. But most of our patients, I would say, are in their late 60s is what the number averages out to.
I mean, my gut is that's about when your knees start getting tired.
Exactly.
Because you've been doing whatever for the last however many years.
Exactly.
And a lot of sports injuries too, right? I mean, football, wrestling, all these guys that probably had some serious contact sports are now in their 60s going, ugh, I can't do what I used to do.
Exactly. And all that trauma over the years has made a major impact in their knees now as they've gotten to this age, and they want that relief. Finally, they want the relief. So.
Right, and then think about it. Every 6 months to 2 years, you can continue this forever.
Exactly.
Like, why not? It's so great. We're going to take a quick break. When we come back, we'll be talking further with our guest, Rakel Assk from New Life Medical. You're listening to The Patriot.